The Dignity for Incarcerated Women law is important because it breaks generational curses that have existed since the inception of this country. My ancestors were brought here shackled while pregnant. I was shackled while pregnant, along with thousands of other people who have been shackled while pregnant. And so we were able to break that generational curse that has existed since this country's inception. Number one, I think that's important that we break generational curses. But number two, it's important because it names dignity. It names that people were being treated without dignity and without honor. And so to name something, the Dignity for Incarcerated Women, is a real testimony to what incarcerated people and women have been saying for many, many years, who were not heard by system actors, who were not heard by their community members, that they were being treated poorly. And so number two gives honor to the struggle that so many people who are in jails and prisons have struggled under for many, many years. And I think the third thing, while it's important, is because it reframes the narrative around people who are incarcerated. It forces society at large to acknowledge that people who are incarcerated, number one, are people, and number two, they are deserving of basic human rights. And so we strove to write a bill that would honor the humanity and dignity of people. I think that people should know that the fight to attain dignity for incarcerated women is not over. That getting the bill passed was just the first hurdle that we had to overcome. And now we are in the phase of implementation. So ensuring that providers understand what the law is, what the rights of the patients are. I think patients need to understand, people who are incarcerated need to understand what their rights are and what should be afforded to them. I also think correctional staff need to know the rights of the people who they have in their custody. People need to know that nutrition has been regulated, that shackling is banned, not just in jails, but in prisons in all counties, that your baby should be placed near you if at all possible, that you should be able to have contact visits with your baby if you've had a baby while incarcerated. And I think another thing is that you don't even have to be pregnant for this bill to impact you. If you have menstrual periods, now you have access to menstrual products that previously you did not have access to. And so we were really thoughtful about how we approached dignity for incarcerated women, and we tried to make sure that we left no woman behind when we enacted this bill. I think I want to be clear that none of our work around providing dignity for incarcerated people is an endorsement or legitimization of the carceral state. We are still very resistant to the way people are treated inside of carceral spaces. But while we work to dismantle those spaces and the conditions that lead people to those spaces, we also have to honor that people are in those spaces and deserve to be treated humanely. So we have done the work of balancing the need for people to be free, but also helping them to be healthy in the current state that they're in. If you are someone who is pregnant and incarcerated, and or have a family member, if you work in the corrections facilities, if you are a healthcare provider that provides care to people who are incarcerated, there are resources and trainings available, and those resources and trainings are available at incarceratedwomenshealth.org. Please visit, please attend trainings, please disseminate the information, please familiarize yourself with the way that incarcerated people should be treated.